Thank you very much. Good morning, Paritosh. It's a very early morning for you.
So good morning, everybody. It's 7 a.m. and you know, Benedict.
I hope you had your coffee.
We have been many 6:30 a.m. calls, both of us. So no worries at all.
Okay, Paritosh, give me a few minutes. I will do some introduction words also in German to give you a little bit more of the context. Also ganz kurz auf Deutsch, warum stehe ich hier heute, X-tention und GE? Es gibt in der X-tention-Gruppe eine Firma, die ICW, die eine lange Geschichte mit GE hat. Und das möchte ich ganz kurz umreißen, warum und woher das kommt. Also seit 2015 bereits, eigentlich bis 2010 zurück, gibt es eine bestehende Verbindung zwischen GE und ICW. Das GE Vendor Neutral Archive hat Komponenten von der ICW verbaut. Gibt es über 100 Installationen weltweit, wo sozusagen unter der Haube von GE VNA ICW-Komponenten sind. Also es ist eine bestehende Partnerschaft und die haben wir letztes Jahr noch einmal intensiviert und erweitert, um eben auch Health Service Bus-Komponenten, um Orchestra-Komponenten, um eine Initiative voranzutreiben, die GE unter dem Namen Edison treibt. Und da werden wir heute noch was hören dazu, um was es da geht. Warum in Englisch? GE Headquarter in Milwaukee und wir sind dort mit dem zentralen Produktmanagement in Verbindung und Paritosh ist, wie in der Einleitung gesagt hat, Senior Vice President für das ganze Thema Digitalisierung. Das heißt, GE will eine digitale Plattform aufbauen und für alle ihre Produkte und die wird eben Edison heißen. Okay, Paritosh, sorry for the quick German intro, but I wanted to give a little bit of a historical context also on how we worked together in the last 10 years, also with your relationship with ICW. Paritosh, I would like that you give a quick intro about GE. GE is in the news right now, a lot. Perhaps you can give a 30-second context also what's happening there, and a little bit more about the Edison platform plan and how Orchestra is helping with achieving your goals there. Thank you.
No, absolutely. And first, Benedict, it's as I mentioned, it's great to be here in this forum and sharing our relationship, our partnership, as well as what we are doing with Edison platform with the audience. GE Healthcare is a $18 billion company, approximately same amount of euros, although slightly less euros now with the exchange rate, but close to 17 billion euros. About the size of Siemens Healthineers, who you might know quite well in the region. And our primary businesses are making medical devices in diagnostic radiology world, diagnostic cardiology world, X-rays, CT, MRI. But we also have a very strong franchise in time series data collection, for example, ECG machines or anesthesia machines, ventilators. And we are organized in different P&Ls or business units. So ultrasound is a big business unit, imaging is a big business unit, and the time series data, we call it LCS or Life Care Solutions, is another big business unit, about $4 or $5 billion in size. And then our last large business unit is services. We service the equipment. It also requires a lot of data coming from telemetry devices. So that makes up our business overall. What we are doing over the last 4 or 5 years, is moving from a classical diagnostic imaging world to how do we add more precision into the diagnostics and analysis. So we have embarked on a partnership recently with Sophia Genetics, actually. It's a company that analyzes genetic sequences. With that, you can better focus on the risk profile of the patient and how the disease is evolving. So that's the overall business. And I work in a horizontal pillar that is establishing a sort of common digital thread across all the businesses of GE Healthcare. So I'll pause there and see, Benedikt, if you want to sort of have any elaborating questions on that one.
Yeah, thank you, Paritosh. This platform that you mentioned, this Edison platform, it's an initiative and a technology solution. And I know you prepared some slides where we go into a little bit more detail about what kind of goal you want to achieve here on the technology side. But I wanted also to mention that this is a true platform that's built here. It's not something like a one-off solution for one of those businesses. It's a platform that should facilitate all those different business units. And one essential part of it is connectivity. So every GE PACS, every GE MRT needs connectivity. Every software solution of GE needs connectivity to the local RIS, to the local hospital information systems. And that's where Orchestra comes into place. Paritosh, I know you have prepared some slides to go a little bit more in detail on the technical side. So I would say the stage is yours on these. Okay.
Great. What I'll do is I'll go reasonably quickly through the slides, and then Benedikt, feel free to raise a question or pause, and same with the audience. Yes. But I didn't want to spend sort of too much time in sort of describing the details, but I want to give you a flavor of what we are doing. This is a little bit of preview of one of the presentations I'm giving at. Can you see my screen?
Yeah, I think that the online community sees your screens. Oh, no, okay, perfect, thank you.
All right. So, look, I worked in a hospital for 6 years. I was based in a cardiology department. It was about 30 years ago. So the digital data was still in the early days, but you face this every day. Those of you who are either at the customer side, either at the hospital or interfacing with them, that the data is expanding every day in the healthcare area. And with new advances like AI, one of the major challenges that everybody is facing, we as equipment providers, as well as hospitals as care providers, is the data sits in departmental silos still. Yes, you have the EMR, but then you have PACS and RIS that is holding the imaging data. You have the LIMS. And now remote patient monitoring, right? You have the wearables, blood pressure that people are going home with so they can be monitored better. And I already spoke about genomics in here. So one of the challenges that we see in making healthcare more efficient, because it is not efficient right now, especially in the US, we spend the most money in the world and we have not as good healthcare as in several of the developed countries. Europe has much better healthcare, much better optimized, but in the United States, there's a lot of waste, a lot of repeat procedures, a lot of errors. And the problem that we are grappling with is EMR by itself is not enough. Data is exploding. There is a care continuum from hospital to home. And there is a need for a comprehensive platform that is going to sort of help radiologists, cardiologists, physicians. Oftentimes they are swivel chairing. They're looking at EMR screen from Epic, Cerner, Meditech. They swivel to some other screen and they try and clinical picture together, put the clinical picture together. Now, the mission everybody is on in the sort of digital care pathway optimization is have technology aggregate the data and generate insights. And this is common sense. You all deal with this. We deal with this every day, and we are not the only ones, but we are moving very fast in this direction in partnership with Extension in some of the key areas. So at the bottom, you see different data sources. There's a very strong component that we are building, which is a clinical data aggregation platform that will pull in this multimodal data, index it, organize it, add attributes even from textual records using technologies such as NLP to create more insights. And then we have a very strong orchestration engine that is able to plug in those AI algorithms in the right place in the workflow to help the clinicians. So it's not just that. This is not just for GE to develop solutions, because we know we cannot do it alone. In fact, we are very humble in that regard, that most of the advances in AI are going to come from outside of GE. And one of the objectives here is, how do we host these third-party innovations, either from hospitals, either from partner communities, from startups, and still provide that workflow to the customer. So this 4-blocker is very simple schematic of what we offer here. So one is very strong foundational healthcare services. Think of it as what Apple has done with iOS as an operating stack or the layer. It's an application hosting framework. There is very strong orchestration and prioritization and scheduling, which is important in clinical workflow. If I have a patient with a stroke exam, those jobs are more important than someone who is come in for a less severe condition, and that prioritization needs to happen. The data aggregation framework, I'll highlight a little bit, where we are really working in close collaboration with Extension. And then we have value-added tools such as natural language processing, voice, computer vision to enable the workflow. This is available on appliance, data center, as well as cloud. And in medical applications that go through a very strong regulatory approval, the life cycle management becomes quite important, right? There are recalls, there are updates, there are cyber patches. So we have stitched a strong life cycle management framework that the service team, right? Oftentimes, if it's a GE application, they pick up the phone or they go on their web portal and put in a ticket at GE. But how do these sort of concerns get handled properly from a service perspective? And the last block is very, very important. And I mentioned earlier, most of the innovations are going to come from outside GE because most innovation happens in the field in streamlining the workflows. And we want to create that innovation engine where third parties could develop applications, host applications, and we can act as an application orchestrator, distributor for these third-party applications. So that's the vision. It's not just a PowerPoint. Today we have an installed base of over 100 sort of sites and applications that are running it. Largely, they are applications developed by GE. We have about 20 plus startups that we have onboarded in it. And at this RSNA, we are actually running a hackathon with about 10 startups that are using several of these building blocks and integrating their applications on Edison. A little different schematic, and then I'll just pause after one more slide and sort of take any questions. I shared this in sort of words in the earlier slide, but this gives a little more graphical overview. Clinical data aggregation is where it all begins, because all the innovation, all the applications that are hosted on the Edison platform have to work on patient data, multimodal patient data, from EMR, from what is coming from home, from what is coming from our imaging systems, as well as other vendors' imaging systems that go in packs. And this is where we have embedded Orchestra as a key component to help us wire up the ecosystem that exists in the hospital. We right now are actively involved with Benedict and his team in developing one of our next generation sort of a very small footprint ultrasound scanning machine, right? A probe and an iPhone, for example, being able to scan ultrasound images and pictures. And how does the data get handled? How the patient consent, who can look at the images, audit, traceability, tracking, all that data flow becomes quite important. But also on premise, as we take the Edison platform to each one of our customers, and we have several thousand of those in 160 countries. We have about 4 million devices of different vintages and different types in the field. One of the biggest challenges that we have to encounter is what is the logical and practical way of aggregating the data. And this is where Benedict, Thomas, and rest of the extension ICW team is actively engaged, to the extent we have, I don't know, Benedict, 3-4 meetings every week, and it's a very, very active collaboration and effort.
Yes, Paritosh, and if I can add here, one very interesting thing, you know, all those platforms, if you think of Google Health or Amazon, they're all platform, or Microsoft Health Vault also tried to build something like a health platform. But what I find really intriguing with this GE approach to this, they come out of healthcare. So GE, Precision Healthcare, they brief healthcare, and they totally understand that any platform deployment, any Edison deployment has to be hybrid. So it is good to have a cloud-based approach here, but, and there's a big but, you also have to have a strong on-prem option, because healthcare, you know, security concerns, localization needs is something that we have to really be aware of. And this clinical data aggregation with also the Orchestra service bus is building this two-level, or is working with this two-way approach. The probe project that Paritosh was talking about briefly is a pure cloud-based deployment. So it's a DICOM web interface in the cloud where the probe sends the data together with tokens and all the security stuff, because it can. But in a healthcare environment, in a hospital environment, you need to have an on-prem connectivity. Yeah, you cannot send things to the cloud with patient context, not always. So we have an on-prem installation that works with standard Orchestra components in a cloud connector way. So we integrated a cloud connectivity, which works without VPN through port 80, and you can send data from on-prem to the cloud in a secure way. And all those little things need to work together to be a real successful health platform. And I think GE really understands, because you come from healthcare, understands the nits and grits here and why it's not enough to have a great cloud platform like others do and think that this is solving all the problems.
I think that's, if I could just add, that's an important point. You can do good bit on cloud, and we actually began our journey because we are, you know, some of the key applications that we started building on Edison platform were needed to be close to devices. So our first inroad was really bring a very advanced Kubernetes-based stack, which you typically see on cloud or on VMs, on-prem on servers, close to the scanners. So we are doing deep learning AI reconstructions on our, you know, 20-year-old scanners by having an AI engine that is pretty close and on-prem. So you're absolutely right. We used perhaps a harder approach of tackling it on-prem data center and then cloud. Others have often gone that there is a set of applications that are less latency sensitive. One of the applications that we are actively working on, actually we have finished working on, is, and it's very interesting having the digital technologies, it monitors ICU signals, right? And how do you create high availability and sort of a failover, right? Or things you expect on cloud, right? That my pod is always going to keep running. I'm going to instantiate, spin off a new pod if need be. But how do I upgrade the software without breaking the ECG trace of the patient in ICU, right? And this is a challenge on Edison.
It's a hard challenge,
right? So some of these things are quite important and quite strategic. If you want it to create that framework where you can, in future, we believe most hospitals will go towards hybrid and clustered computing in a secured way. So there will be some things, and we can debate, is it 5 years, is it 10 years, but some things will remain on premise that are latency sensitive. You have to have data without any error in a small amount of time, and some computations will be dispatched to cloud, things that can wait.
I see it absolutely the same way, and it's great to see that you're supporting both approaches with your platform. And I would like to stop here and give the opportunity for questions. Also, the audience can raise questions in German. I'll translate them, it's no problem.